I want to touch on something briefly today that has to do with practice valuation. And this is kind of something new that I see emerging. And, I'm always asked questions about, what's the magic formula? Is a practice worth, 60%, 80%, 40%? What's the magic number? I break this into two sections, part one and two, but I'm going to show you two things that are actually outside of the numbers and that even an accountant can't assess. And this is an area of concern for me. And so this short segment is titled Practice Valuation Dilemma. And what I want to talk to you about is something that I call practice velocity. And this is kind of a new emerging issue. And so when you look at a practice, it takes a lot of expertise and to drill down and look at the mix of services. And what I'm talking about is the percentage of fee-for-service versus PPO. And so what I want to do here is I just want to briefly touch on some things here. A good fee-for-service practice should have an overhead of about 50%, okay? Their structure is completely different. There are very few fee-for-service practices left. It's probably less than 10%, approaching 5%, but let's use that as a benchmark. And what I want you to understand, because I don't see brokers telling you this, as the mix increases, the overhead increases, and I think I'm blocking this last one here, but an 80% plus PPO is going to have an overhead of 75% plus, okay? So understand that this mix of services, fee-for-service PPO, affects overhead, okay? That is point number one. Point number two is the term that I use on catching a falling knife. This is a term off of Wall Street, and this is referring to buying a stock that's in decline. And when a stock is in decline and you buy it, there's always this risk that things are going to continue to go down, and it's the equivalent of catching a falling knife. Ideally, you would love to buy a stock at a bottom. You caught the absolute bottom and you have all this upside. It's no different with practices. And the reason I bring this up is that a lot of practices are still in a state of either decline or flat revenues, okay? And the reason is really obvious. Since 2009, dentists they just haven't learned how to market. There are a few practices that do a good job, but the vast majority are clueless as to marketing. The marketing solutions that I see in the journals are awful. They're horrid. That's another topic for another video, but that's the reason for the decline. And so what happens is, if someone is selling a vintage or mature practice and the practice is in decline, the first thing they do is they sign up for some PPOs and try to increase patient counts so that they look like they have a steady influx of new patients. If you don't know how to market, this is the easiest way to do it. This graph that I want to show you here shows a practice in decline and an increased participation in PPO. This is an extremely dangerous scenario that needs to be evaluated, and this is outside of the scope of what an accountant does, okay? This in-depth analysis. So what happens here is that if you have a practice that was fee-for-service and they have a higher overhead structure, then they start to participate in PPOs because of the reimbursements, you can get in a situation where you're insolvent. You are absolutely broke. And so what you're trying to do when you buy a practice is to, in a snapshot in time, say, I can stop the decline of this practice, I can, slow the participation in PPO. That's a pretty dangerous scenario that requires some pretty intensive look. So I just want to give you the heads up of something that's kind of emerging in the valuation space.